afternoon, or good evening, wherever you may be in the world. Everyone, my name is Deanna Brown, and I am the Youth Environmental Justice Policy and Programs National Director for Young, Gifted, and Green. And thank you for joining us for this important event today. Today, we gathered to discuss a topic that affects all of us, our air. We'll explore the transformative impact of the EPA's air pollution standards from 2021 to 2024. These regulations are more than just policies. They're lifelines that have saved lives, improved health outcomes, and helped build a safer, more equitable environment for all communities. Our time together is focused on two things: reflecting on the progress we've made and looking ahead how we can sustain and expand this momentum. We'll learn about the groundbreaking findings of the Breathing Easy report and discuss actionable steps to continue in addressing air pollution and environmental health disparities. What makes this conversation even more meaningful is the role of young leaders. Youth voices are not just the future, they are the present. Today, we'll highlight the critical contributions of youth in advancing environmental justice and fostering healthier futures for all. So we're at a pivotal moment where challenges of air pollution, climate change, and public health inequities are deeply intertwined. Tackling these issues require collective action and innovative thinking. Collaboration between policymakers, scientists, advocates, and community members, including youth, is essential to driving meaningful and lasting change. This event is more than just a presentation. It's a space for learning, dialogue, and action. It's an opportunity to come together and identify the intersections where our efforts can make the most impact. Whether you're a community advocate, a youth leader, or policy expert, your role in this work is invaluable. Environmental justice isn't just about policies. It's about ensuring every person, regardless of their zip code or income level, has the opportunity to breathe clean air and live a healthy life. So let's go into our agenda for today. We have an engaging and thought-provoking lineup for you today. We'll begin with insights from the Breathing Easy report presented by Jeremy Symons from the Environmental Protection Network. He will walk us through its critical findings and their implications of our communities. Next, we'll move into an interactive discussion that allows us to share our experiences and solutions for addressing air pollution challenges. This will be followed by a fireside chat featuring youth leaders and experts, including Dr. Dan Costa, who will help us connect the dots between policy, science, and action. Finally, we'll close with a tangible call to action, including how you can make your voice heard through initiatives like the Defend Our Climate Action campaign petition. This is your space to engage, ask questions, and to collaborate. Let's make today a moment where we're not only here to learn, but also commit to action. Together, we can create a cleaner, healthier community for everyone. And now I would like to pass it to Mr. Jeremy Symons to introduce himself.
Thanks, Deanna. Thanks so much for what you're doing, and thanks for the invite to be here. I'm Jeremy Symons. I'm a senior advisor with the Environmental Protection Network, which is a network of former EPA staff and officials like Dr. Costa, who have spent their careers working to protect public health and the environment, and even upon leaving the agency, continue to volunteer their time to help make that happen, help communities, and help really advance what's needed to protect public health for people of all ages and in all communities across the country. And Dan, did you want to go ahead and introduce yourself?
Oh, okay, sure. I didn't know if we were going to wait till later. Yeah, I'm Dan Costa. I was with the agency for 30 some years. I was a staff scientist and a section lead for about 20 some years, and eventually became the director of the Air, Climate, and Energy Research Program, which oversaw all of the research on air quality, whether it was physical health or control measures. So hopefully I can provide some. I did some work with asthma, so I can hopefully address some of the questions that people may have.
He's the real deal.
I'll have to check my ID.
Thank you guys so much for that. And I'll pass it to Jeremy to walk us through the Breathing Easy report.
Sure. So thank you for that. So we did a report, when EPA when the Environmental Protection Agency does rulemakings, basically what it's doing is it has responsibilities under landmark environmental bills that were passed on a bipartisan basis many decades ago and have been updated a few times since. They have a responsibility under those laws to come back and update those rules over time as technologies change, as science updates, to make sure they're being protective of public health. And we went and looked at rules that had been the EPA had finalized in the last 3 years. And every time EPA does one of these rules, they do a very detailed regulatory, what's called a regulatory impact analysis. But I mean, it can be many hundreds of pages that's really based on applying peer-reviewed science, the most up-to-date science, to the regulatory action where they've evaluated both what the public health benefits would be and what the cost to regulated industry would be. And every time that they do a rule, they release this and they provide that information. But nobody had really gone and looked at the sort of the big picture of like, what does this all add up to? So we're not able to cover everything that EPA did, but we did look back over 3 years, and particularly at rules coming out of the Air Office. So of course, EPA deals with air pollution, EPA deals with water pollution, EPA deals with toxic chemicals, forever chemicals, PFAS, and others that are significant concerns. We just really looked at air pollution regs. We looked at 16 of them that have been done in the past 3 years. And I believe I now have Santa Claus coming by with a full police escort outside my window. So sorry if you're picking up any sound from that right now, an annual tradition here in Virginia. Um, so good timing. So anyway, we looked at these 16 rules, and these rules, they cover, I mean, the Biden-Harris administration, under the Biden-Harris administration, like EPA was very busy taking care of tailpipes from both passenger vehicles, but also large trucks, smokestacks, pollution from power plants, oil and gas industry, methane pollution, cross-state air pollution. So there's a number of rulemakings that they had done in air. And what we found was nothing short of jaw-dropping. These rules, when you look at the totality, will prevent 100 million asthma attacks through the year 2050. So 100 million times someone doesn't have to think about whether to reach for, an inhaler. As someone that we know, I think 1 in 12 people in the country have asthma. We also found that it's going to prevent 200,000 deaths. And it's important to think about like what that means. So when you talk about preventing death, this could be from lung disease or heart disease or from cancer. It's not right. Not only are you prolonging life, but you have a healthier life, right? You're talking about family members who are at the holiday table, right? That might not be there or that are healthier, when they're there, right? It's sort of the ultimate expression of what it means to be healthy, to be alive, but it's more than that. But if you think about 200,000, it's hard to imagine that. But if you lined up an entire convoy of buses from Philadelphia stretching all the way to New York City, like everybody that gets off that bus at the end of the destination is one of those lives, right? That would be with us, and that will be saved. So this is really quite significant. This does have cost, and it's important, and EPA always evaluates the cost, and to see whether it's reasonable or not. But like decades of regulations before it, it turns out that these rules have a significant health savings cost benefit that significantly exceeds what they were going to achieve, what it cost industry. So on average, 6 times the benefits were 6 times what the cost in the regulated cost is, and anybody has to pay that. So those costs are real and they need to be considered, but the health benefits certainly way outweigh them in this case. And we're talking about $250 billion in net benefits annually from these rules. So that's just the air pollution piece of it. And we thought it was really important because in this day and age, there's a lot of talk about, you know, regulations, you know, needing to be cut back, you know, and there's a lot of talk about bureaucrats, you know, off doing this. Well, and Dan can talk, you know, more about what it is to come to the office every day and think about just what it takes to protect health and community after community, because at its foundation, EPA is a community organization. It serves communities, even though it's headquartered in Washington. And I think that's really important. So we've just been working to get the word out what the stakes are if we pull any of that back and go the other direction, which certainly some have proposed.
Thank you so much, Jeremy, for that. Dr. Costa, did you want to add anything?
Um, a couple things. We're not going to get really wonky, obviously, with all the rules and rule makings, but EPA puts out all kinds of rules, whether it's to control emissions, all of that kind of thing. But as far as air quality goes, there is the Clean Air Act, the amendments actually, but it's sort of nominally known as the Clean Air Act of 1970, which is the big sort of gorilla in the room. That particular piece of legislation established the the national ambient air quality standards, basically the standards of air pollutants, of the major air pollutants at the time, not what was directly coming out of the pipes, but what's in the air. And that would be particulate matter and ozone and nitrogen oxides, and lead was a big deal back then. It still is, actually, both in air and water. Um, um, Carbon monoxide, sulfur dioxide. And what they established in that particular rule was that there would be a periodic review of all of the scientific literature under that particular pollutant. And you would look at that literature and come to an assessment of what is the real impact? Is it significant on health? And the rule says that only when you make the decision establishing a standard, it can only be based on the health data that, that has been reviewed. That's really significant because typically what happens is they come up and say, well, these are the benefits, and then a whole bunch of people do analysis and say, well, this is what it's going to cost. Well, I don't know if we can afford that. Well, in this particular case, it says we're going to base the standards on public health. And those standards will be established. After they're established, and they go through an incredible process, which is more than what any drug goes through in the FDA, quite frankly. Um, and after that, there's an impact analysis where you figure out how much it's going to cost and that sort of thing. And the states are told that they have to meet these standards if they want to continue to get highway funds and other things. So it's an incredibly powerful rule that's driven entirely by public health. That isn't to say politics doesn't come in and play all these other roles in there. But when you think about that, anything that would chip away at sort of the essence of that rule, the entire building would collapse. And that's been incredibly effective in saving millions of lives, as Jeremy has pointed out. And hospitalizations and missed school days and work days and economic benefits and technological benefits that have come with trying to meet these standards.
Thank you for that. Thank you. I really enjoyed both of your responses. I really appreciate the Breathing Easy report. And I really love how easy it was to read, and how easy it was for the youth that I work with to read. That was just very, very awesome. So I thank you again,
That's great to
Jeremy,
hear.
for that. Yeah, I assigned it to them like, this is easy to read. You guys got this. And thank you, Dr. Costa, for all of your work that you've done, and all the work that you will continue to do and your expertise being here. So I want to move to our interactive discussion. If a couple of people want to come off of mute, all you have to do is raise your hand and we'll go by that. But as we heard powerful insights from Jeremy and Dr. Costa, Let's connect these findings to our own experiences. Air pollution impacts all of us, but the effects are often felt most acutely in specific communities. So I want to see if anyone in the audience have any air pollution challenges that affect your daily life or health of your loved ones. I know for myself, my late grandmother, she had asthma. She grew up in Chicago, moved to Detroit as a child, and then moved to Flint, Michigan, where I was born and raised. And just seeing her take an inhaler every couple of days just because she couldn't really breathe. So I know I saw that growing up from my grandmother. I have a couple of cousins who have asthma, and just knowing the industry that we have here in Michigan, with our factories, with automotive industry being here, and all the other industry we have here in Michigan, just being an industry-based state. That's just what comes with it. So does anyone else have any other experience with that, or anyone wants to come off of mute and say that? Molly?
Yeah, so I live in Sulphur, Louisiana, where there are a lot of refineries around, and every single time about that I'm on the interstate, I smell like horrible, horrible stuff. And it's like, and as I'm learning more and more about what they're releasing and what the smells are, learning about like stuff like get lightheadedness and headaches and all this other stuff while I'm driving. And it's like, I don't even know what to do about it. Like, I try to cover up my nose, obviously doesn't help. And so, yeah, I noticed that. And also, sometimes when I go outside at night, it smells also awful. So, that's some of my experiences.
Thank you for that, Molly. Yeah, I've been to Louisiana many, many a times, and being in New Orleans and knowing what Cancer Alley is, and just all the refineries that are in that 90-mile stretch. So I can only imagine what the other parts of Louisiana look like as well. So thank you again for sharing your experience, Molly. And now I would like to move on to Sarah.
Hi, I'm from Change the Chamber, just to give you my background. But I grew up in an area that wasn't um an environmental justice community particularly, but in the Northeast, we have a lot of air pollution that like goes from state to state. And my dad actually is a lung doctor and a long-term volunteer with the American Lung Association.
Hmm.
So I know my entire life growing up, he would tell my sister and I and my mom when there were days where we just shouldn't spend much time outside because of the air quality.
Yeah, I remember the Canadian wildfires and how that affected us in Michigan and mid-Michigan at that, and not just the UP. And not just, New York got hit really bad with the wildfires, fog, but how that just travels down from state to state and how it affected the whole Midwest and Northeast. So that's really interesting about that, Sarah. Thank you for sharing that. Will anyone
I
else like to share
mentioned,
their story? Oh, sorry, Jeremy.
like I just mentioned two things. Yeah, I grew up in New England too, and when I got to EPA, when I was there a long time ago, I started seeing sometimes I would see it referred to New England as like the nation's tailpipe, because the way that
Mhm.
the air pollution travels west to east and sort of up that corridor, to some degree, that cross state, Sarah, that you were talking about. You mentioned the American Lung Association. I just want to give a sort of a personal shout out, to your dad, for volunteering. Anybody that volunteers their time, it's awesome in any space, for your community. But American Lung Association, one of the things it does is it releases an annual State of the Air report. And it looks like, Deanna, you're familiar with this, but I think like one of the big differences between like the Earth Day movement before my time even, and today is sort of like pollution's become invisible. You can still smell it. There are times you can see it, But even when you don't smell it and you don't see it, it can still be there. And the State of the Air report found, most recently that there's 130 million people that live with air quality that's below the health-based standards that Dr. Costa referred to and worked on. And that's just mind-blowing to me, that we that we haven't not only that we haven't solved that, we certainly, air quality is a lot better, right, than it was decades ago for sure. But that we haven't solved that, so we're all breathing healthy air, and that it's also kind of invisible. So I think industry lobbyists take advantage of that, for sure, because I've dealt with that, many times over the years when they're trying to roll back some of these regulations or oppose them, from my work outside of EPA.
Oftentimes when I lecture about air quality and health impacts, I oftentimes talk about the significance of averages. We have national ambient air quality standards. Those are numbers that apply and based on monitors, some 1,800 monitors that are scattered around the country. I don't have one in my yard, nor do either of you probably, or anybody else in this room, but things are plotted through statistical methods in terms of trying to assess exposures in different areas. And those measurements are very important and do very well, because within this Clean Air Act, not only does it set standards based on health, but it must consider susceptible or sensitive groups. That would be older people, younger people, people with asthma, theoretically people from socioeconomic disadvantaged areas. But it's very difficult to do that over a huge country while we're measuring these things. And with the growth of small monitors, you can buy them on Amazon now for $50. They're not very good, but they can give you some estimate of what's going on in the area. But oftentimes when I lecture, I talk about, if you look at a lake and the level is nice and pristine and you see the trees all around it and it looks very clear and the level is going down, that's sort of the average air pollution is going down. But eventually it gets to a level that's low on average, but what's popping up are the tree stumps and the old tires and the broken down cars, and those are point sources around which oftentimes socioeconomic disadvantaged groups live. So their exposure is going to be higher. Their access to health care is going to be lower. Their education level may be somewhat stressed because they haven't had adequate funding. All of those are factors that play into this that are very difficult to fully incorporate. And it's also interesting when you think about, I forget whether Jeremy, whether it was you or someone else mentioned that the air looks cleaner. It's very much cleaner. When I was a little boy, which is way before anybody's time on this thing, when I used to watch smoke coming out of the power plant, I used to think that made clouds. And there was dust everywhere. You could smell it. And in the London smog of 1952, which is like the big event that people often talk about, 5,000 people died. There was a physician in one of the hospitals there who said people's interest in air pollution is directly proportional to the amount that they can see. So what happens is air pollution levels go down and down and down. We're all busy doing work, getting schoolwork done, getting kids to soccer practice, trying to make a living, all of these things. And the air looks pretty clean. Everything looks pretty fine. Most of that dirty stuff is cleaned up. Those national ambient air quality standards are largely responsible for driving that. But those things that you smell along the highway from the refineries, those chemicals, there aren't standards of the same ilk for that. Those are controlled by technology, which are not very good. And they're much more sort of arguable in the courts and that sort of thing. So even though you tighten some of the emission levels, they still get out there and they smell. And so the air pollution, the whole thing is a dynamic system that's changing. It changes regionally, near sources, near places. And that's a difficult, you know, cow to lasso and get it all under control.
Thank you. That was just so powerful. So we've discussed the challenges. So let's try to focus on some of the solutions. How can we work together to reduce air pollution and improve health outcomes in our communities? So, a question I want to ask the audience, what are some strategies or actions you think will make the biggest difference in reducing air pollution where you live? So we can talk about expanding community-based air monitoring programs, advocating for green infrastructure to absorb pollutants, or promoting stricter emission standards for local industries. So does anyone have any ideas or strategies they would like to discuss? Molly?
Maybe like some easy ways to report when you smell those um smells from the refineries, because I know that there's an app called Smell My City,
Hmm.
which I try to use as much as possible, but something more serious, like for it to be actually recognized. And because I mean, smelling that stuff on the interstate like is not safe. So I don't know, something that's easier to report, because I have found something else, but you have to fill out a million things.
Thank you for that, Molly.
I
Does
might
anyone?
mention,
Oh,
I'm sorry if someone wants to
nope,
speak.
nope, you got it, Dr. Costin.
It's kind of interesting that at least in North Carolina, where I live, there was I'm not sure whether it's still enforced in any way. There was this thing about if you saw a car on the road belching black smoke, you could take down the license plate, report it, and the state would actually send the person some kind of note about being a dirty emitter. I don't know if there was any penalty associated with that. When it comes to things like the hydrocarbons that are associated with different kinds of refineries and that sort of thing, that's a huge, huge corporate economic driver in the community. I've worked with a couple of communities in Tennessee who live near, well, as I mentioned before, these point sources where the land is cheap. There's nobody who's going to argue with them. They're on, suburbanites who are going to complain and have some power, have that kind of thing. And so much money goes from them to paying taxes, etc., that they can drive the political machinery to suppress some of that kind of information. And I think over time, the grassroots, I don't know how to set this up, and I'm hoping that it slowly evolves, that there, with all of our social networks, to set something up where people can queue up. There's a fellow who invented an app about trash. And if you saw a piece of trash in your community, you could take a picture of it and upload it to your community thing where everyone would see it who's on that app. And if we could do something like that, beginning with smells and what we see and emissions and that kind of thing, to slowly get people's attention. It was interesting back in the 70s. I sound like an old guy, but when people talked about acid rain, it was killing the fish, it was burning up the forests. It was this haze over the national parks. And what happened is people taking vacations like to the Grand Canyon. You'd have a week off, you drive your kids there in your Chevrolet station wagon, and you look and you cannot see across the Grand Canyon. The Smoky Mountains are so smoky you can't see anything. You're in LA and you can't see the mountains there either. What happened is people went home, contacted their congresspeople or congressmen at the time, and just complained and complained and complained to the point where both an environmentalist and people in the Bush, the elder Bush um, government or administration drove a piece of legislation into the Clean Air Act to control sulfur, which the industry said, oh, it's going to kill us. We can't do this. We need to generate power. We need electricity. That's before all the stuff we use now. But nevertheless, they did it, and they did it by a cap and trade, which was sort of a market-based system. And it was the people driving that, and all of a sudden the sulfur levels went down, and people now you have clear air over the Grand Canyon. You don't have burning forests. So it was driven by people speaking up and doing something within their capability at the time, which was writing letters. Today we have so much more, but we're distracted maybe by looking at little videos on TikTok or something. I don't know. But I'd love to be that kind of young person again and have the energy and the creativity to do that, because I think there's something there that can be done.
Thank you, Dr. Costa. And we see that Vanity has their hand up.
Hi, so am I audible?
Yes.
Oh, so first of all, thank you for this insightful talk. So, and I just wanted to share that I don't, especially US might have done, might be progressive in this particular aspect, but from the countries in Asia and Africa, I don't see proper urban planning. So where they promote green spaces and zoning laws to separate industrial areas from residential zones. So that is a pertinent issue I have observed when I travel to Asian countries and African countries. So that is one thing that, and also they don't incorporate greenery into their urban architecture. So green roofs or green walls and stuff like that. And I also worked on bioengineering, where we can use some algae and plants to absorb some pollutants. So these are some of the strategies I just wanted to mention here that can be implemented. Yeah.
Thank you so much, Vanity.
Mm-hmm. Thank you. Thank you.
Dr. Costa, Jeremy, do you have anything to add?
No, I think I think the ideas are great. It's just getting them moving forward. I mean, it really is something that is not going to happen by itself. It needs to be driven.
And look, I agree with that. And people are like, we're in an uncertain time where public voice is going to matter a lot. There's both, the local issues like Molly was talking about, where, for an air pollution, like the states have a lot, well, for all pollution, the states have a really important role. So if you think there's something, going on, get involved, start checking out what the Department of Environmental Quality in your state, ask them how they're looking at those issues, and start getting educated on what they do know about what's coming from, that factory. And, I work with places in the Gulf Coast with communities that have a very, they're so beset. Like it sounds like some of these communities are by the industry down there, but they know, like, when there's flares in the night sky, that they see that's an unscheduled, burning off of toxic air pollution. The flares can be different things. They can be flaring like methane gas, which is a little bit more standard, but sometimes, it could be just the last resort, the technology, if you will, plan for when they have gases they don't know, how else to dispose of. And that stuff adds up and can be, really dangerous. And, unfortunately, some of these communities have, are in states that really, you call them and you report it, but they're not really doing that much about it. But some states will. Some states take it seriously. And there are there are air sensors. There's a network, of air sensors out there. EPA has a limited network of, state-of-the-art air sensors, but there's a more informal network too. You can see what's going on. out there. Purple has like some websites where you can see some local air sensors, and their quality is, you know, like EPA won't like accept it for like reporting a violation, but it can certainly increase your understanding of the knowledge there. So you have that local stuff, but talk about what's going on right now. You know, EPA itself is in trouble. And, you know, President Trump, you know, has laid out an agenda of rolling back the regulations that we talked about, and President-elect Trump, say, that we talked about. His first term, he tried to cut EPA's budget by a third in the first year. He's brought in an OMB director who publicly said his goal is to traumatize. He was or traumatize EPA staff so they don't want to come to work in the morning. I mean, there is an agenda here that is far reaching, and you know, but Congress has the power of the purse. Congress has a lot to say over what's going on. And you know, we released some polling that's on our website, environmentalprotectionnetwork.org, that we did post-election poll on what public attitudes EPA. It was very encouraging. You know, vast majorities of the public don't want to see EPA weaken, many of them want to see EPA strengthened. Even 3/4 of folks who voted for Donald Trump don't want to see EPA weakened or eliminated. So when it gets closer to members of Congress that have to go back and get reelected in a couple of years, I think they're going to be more interested in what people have to say. They know that people didn't go, you know, vote at the ballot box this last time based on, you know, EPA, right? But, you know, that doesn't mean they're not going to be attuned to, you know, public support for an agency that if they try to get too extreme and cut it back. We saw that the first Trump administration, Congress soundly rejected those budget cuts that Trump proposed. And administration did move forward with regulatory rollbacks. And that did set things forward. That's part of the reason there's so much benefits to what was done in the last 3 years, is because there's sort of a backlog. And we're going to see that one way or another again, unfortunately. But I think there's going to be a lot of issues in Washington that are getting a lot of attention. And my big concern is that the environment, asthma, public health, the fate of EPA gets lost in the noise. And that all comes down to citizens and to groups like Young, Gifted, and Green, just making sure that you're doing exactly what you're doing here and staying vigilant, which like I'm deeply appreciative of, and everyone that's joined us.
Thank you. And that kind of goes into our fireside chat. Our youth members could not join us today. A lot of them had finals. So they submitted their questions, and so we have about 10 minutes to answer a couple of different questions. So the first question was submitted. It says, how will these new EPA air pollution standards help me and my family breathe easier?
Well, I think we've sort of covered a lot of that already.
Yeah.
So I think there are probably some other questions that are probably a little bit more meaty. I mean, these standards, by lowering the air pollution, you know, there's nothing worse than not being able to breathe. Anybody who's had asthma, and I'm sure there are people here, I've had an asthma attack myself. When you can't breathe, that is the most horrific feeling you have. It's worse than having a heart attack because you can't get air in. So, you know, asthma is a big issue. It's a big issue in the African American community. It's, you know, 17% of kids, and including adults. And most people who die are older people, older female African Americans are the ones who die primarily from asthma attacks. So some kids do too, but it has an impact. Anything that triggers it, you want to minimize.
That's why people, I think it was Sarah, your dad, if I remember, that's a doctor, but so doctors and nurses are some of the biggest advocates for these rules because they see the uptick on unhealthy air days, of the ER visits. And there's a very, there's both a long-term exposure. The studies are very clear on the connection of long-term exposure to air pollution, in asthma, as well as some lung disease, heart disease, others, but also there's the incidence of it triggering asthma attacks on unhealthy air days.
Yep, and I'm going through some of the questions. I don't think this one was touched on. How do these new rules improve the economy while also protecting our health?
Yeah, that's a great one. So when EPA does what I mentioned on like the cost and benefits, and looks at those, so the cost is like a cost of a new technology, right? You replace this technology, older, dirtier, with a cleaner technology. How much does that cost? That's one side of the equation. But on what's on the benefit side, Dan mentioned a few of these. So first of all, you have like avoided healthcare bills, right? I mean, no one can. I mean, how hard is it to pay healthcare bills? Well, if you could avoid paying healthcare bills by staying healthy, that saves a lot of money. You have people who are able to go to school, go to work, hold down a job because they can be depended on to show up to work, right? Which is a challenge too for people who have health problems, right? Those all have economic benefits that you have to, add to the equation. And how do you put, value on life saved? But that also has definite value. So you have improved quality of life, you have improved lifespan, you have people who are working instead of, in a hospital or homesick, and you have kids who are able to go to school. And, you try to monetize those benefits, as well as the fact that, someone's making that clean energy technology, someone has to install it. That creates jobs, that creates economic opportunity. Look at all the jobs. I mean, the clean energy sector is the fastest growing economic sector, right, in the country, and has seen enormous growth in the last few years in jobs. So there are all kinds of economic opportunities out there that need to be factored in, to the equation as well. As Dan said, EPA's job is to set standards based on health. When they do these updates, depending on the rules and different pieces to some degree, they certainly take a look and assess what the costs are and the states that implement these look for some of the more cost-effective options, in achieving them. But at the end of the day, they need to try to get air pollution, down to the point where it's healthy, where the air we breathe is healthy.
Thank you.
I'm getting warmed by this fire, by the way.
And I feel like this would be a good one to answer as well. Dr. Costa, how does the EPA decide which rules to change, and how does it ensure that the changes will benefit everyone?
Okay, again, thinking of it in two sets. I mean, the National Ambient Air Quality Standards and the Clean Air Act are by law reviewed periodically. It's supposed to be every 5 years, but it really doesn't make it because it takes so much time in terms of going through the literature and all, and reviews and public comments, et cetera. The regulatory side for developing, emission controls and that sort of thing is a different can of worms. So what happens is the literature, science is always moving forward and improving in terms of its precision and what it can predict and groups that it can attain. And the two big ones are particulate matter, or soot in the air, and ozone. And nitrogen oxides are another one, from emissions just burning anything. But those two, PM and ozone. And PM is probably the biggest one. Over 15 years of reducing PM, we've extended life expectancy up to 6 months in the general population, which is equivalent to what's been shown on the other side by increasing obesity has reduced life by about the same. it's kind of an interesting contrast. One you can see, one is harder to see. So what happens is all of the science is reviewed. It goes through processing and reviews by various committees. And ultimately, based on the weight of the evidence and how defensible and credible it is, that information is given to peer review committees and the scientific public. The general public can comment, the corporate industry people can comment. Eventually, it goes through the air office, and recommendations are made to the administrator, who makes a decision and then takes a year to put this in place based on more public comment. So this review goes on, and it's driven entirely by the science on that end of things. But particulate matter and ozone, because they're so ubiquitous and so important, are the ones where most of the attention is taken.
I add one thing, Dr. Costa, which is, that's how the process works within EPA. I have worked outside EPA, for a long time too, and would just add, right, that there is like presidents matter, and do help set the agenda for, what moves first, right? There's a lot that could be done, and that can be both good and bad. President Biden, in his very first week, passed an environmental justice executive order, really prioritizing, for example, the EPA move forward and explore certain rules. And that all the stuff that Dr. Costa talked about happens, right? And it takes public comment, years following the science, but it does sort of say, hey, don't forget about this. The same token, President-elect Trump and, Elon Musk, is saying that he's going to create a list of thousands of regulations that, that Trump will sort of erase with a stroke of a pen in his first day. It's not actually how the law works, but that's sort of their intent. But there will be Lee Zeldin, President-elect Trump's pick to head EPA, said that when he got the call from Trump to head EPA, like, Trump had a list, right, of rules that he wanted to be rolled back and rescinded and repealed. So, you can bet that will be first on their list too. So there's a prioritization that happens in addition to the actual element of moving forward on these pieces, which are required under the law by timelines and can also be challenged by citizen suits, public interest groups, when EPA fails to meet the law. And so there are a lot of suits from environmental groups, justice groups, and others, right, that actually can put schedule and timeline that EPA has to hit.
I can add one thing to this. The science evolves over time, both in terms of the data it produces and the kind of science that it is. So much of the health standards have been driven by this branch of health science called epidemiology, where you look at hundreds, thousands of people, and you do all of this fancy statistics. But we're never going to be able to get everybody that way, particularly people in communities at risk. There's a growing component because of some of the molecular methods we have and the monitoring methods we have in epidemiology, and it's called community-based participatory research. And there's work going on. Johns Hopkins has a good program in this. Harvard is doing some of this as well, where in the past, scientists would come and say, I'm a scientist, I'm here to help you. And basically they'd show up and they'd take a bunch of numbers, run off and publish papers. It's changing because no one trusts those people anymore. What's coming in now are people working through, historically Black institutions or other groups, and they work with the community because the community knows what the problems are. And the scientists work to assist them and base them so that they can eventually put together platforms that can move forward that focus on their specific issues. Right now in Baltimore, for example, there's a community that's being exposed to blowing coal dust in Curtis Bay. And the state is now taking this data that's coming out of Johns Hopkins and saying, oh my God, all the stuff that we measured, we weren't paying attention to. Everybody's paying attention to. Now we got to do something. And that's what it is. You got to ultimately hold, in terms of the local stuff, people's feet to the fire, and then things start to happen. I'm beginning to sound like a child of the 60s here in terms of my radicalness, but the issues that we had back then, racial justice, women's rights, the war in Vietnam, corporate overdrive, we have the same ones today. It's time to use some of these new tools, particularly as people making career decisions, to try to move their interests in a way to the benefit, because we made a lot of big progress. Now we need to fine tune these things. And hopefully it doesn't get undermined, as Jeremy was talking about, by dismantling everything. If you're in a boat, you don't need to have a can to bail out water. You're never going to have a leak. Well,
Thank you too for that. Vanity, do you want to ask your question?
Yeah, a quick question to Dr. Costa. So Dr. Costa, I would like to have your thoughts on the risks posed by air pollution to global food security, like through its impact on agriculture. So I would like to know your thoughts on that.
well, air pollution definitely has an impact on agriculture. Even in the Clean Air Act, there are primary standards for human health and secondary standards, which are for everything else, mostly agriculture. And things like ozone have an impact on growth, on crop growth, and and ultimately, again, all of this eventually starts to flow into climate, which obviously has huge agricultural components. We even in only because we're humans and we have limited brains, we have to kind of compartmentalize things and try to do things a little bit at a time. But everything is interconnected. For example, when there are wildfires, guess what gets emitted back into the air, in addition to the smoke and the particles, is all the legacy lead that gasoline put out and deposited in the forests. Some of the radiation from the early atomic testing, which is in the forests in the West, is being released in the wildfires. So you can see the complexity. And what happens is it creates erosion areas that wash everything into the water, and now we have a water problem. So that's why we really have to start to focus in on those things that we can take control of, and really make an effort to use all of the tools that we have available today.
Thank
you so much,
you.
Dr. Costa. Thank you so much.
And as we're approaching 7, I want to ask if Dr. Costa and Jeremy have any last thoughts or call to action before I wrap up.
I'm excited that people are interested in taking the time and during exams and everything else to still stay connected. It's very hopeful to me.
And I just want to thank you, Deanna, and Young, Gifted, and Green, again, for what you're doing, but also people taking the time. You can spend your time doing a lot of things here on a 5 o'clock or 6 o'clock, whatever time zone you're in on a Thursday. Getting that means a lot to us, like Dr. Costa said, just to see your engagement. And I'm sure you're going to go on to do amazing things in your lives, and with that kind of inquisitive nature, engaged nature, and that means a lot.
Thank you. And Camille, you will be our last question.
Okay, thanks. Just really quick, thanks so much for taking the time to speak with us today. So you touched a bit on some of the specific 16 different emission standards for the rules, sort of this gauntlet of emission standards that the Biden-Harris administration had put out. And I know some of those standards have recently been upheld by the Supreme Court, as in they failed to issue a stay on them, even though there's litigation working their way through some of the lower courts for that.
Yeah.
So I just want to know sort of what you think in your expert opinions, if that litigation from those Supreme Court cases, how that will hold up in the upcoming new gauntlet in the upcoming administration of emissions standards, and sort of how we can stay in tune and in touch with the rulemaking process for these upcoming emission standards, like what will change, what will stay.
Yeah, the courts are what is it? The way that the courts are shifting on these issues are a real challenge for EPA, because EPA follows the science and it follows the law. And when the Supreme Court sort of shifts the ground under agencies' feet about like how much like agencies should do to interpret the law, that is going to make them that certainly gives them pause in the best of times. But we're not having the best of times. I mean, it's kind of ironic. One of the things that happened, of course, is the Supreme Court has sort of ruled against this old doctrine, the old Chevron doctrine that gave agencies discretion. And now the question is, well, if the administration is going to be focused on rolling back rules, are they going to stick to the same new doctrine and hold agencies accountable to the law? Because it takes a lot of discretion on an agency to not implement the rules that the Biden-Harris administration, EPA, put forward in the last few years, because they're clearly following the law. And even some of the recent decisions that you mentioned, the Supreme Court seems not to quite know exactly what to do with them. So one thing that's different for EPA compared to other agencies is EPA, the Clean Air Act, Clean Water Act, other laws EPA implements are quite specific and quite detailed compared to other laws. That doesn't mean that Dan and everybody didn't have their hands full and they're trying to like do the science and implement, but like there are timelines, there are health-based standards, there are other pieces. So if the courts are truly said the law speaks, right, and follow it, that would actually stand in favor on these laws. That said, I don't think there's really any question that EPA has had a hard time at the Supreme Court level, and is going to have a hard time moving forward. And I'm not a lawyer, but my observation is that they become almost, when it comes to EPA matters, it's easiest for me to understand the rulings as I would think of senators or politicians. They're sort of seem to have an agenda that's driving a lot of the decisions and really supporting industry challenges pretty much across the board. That said, the district courts, the federal appeals courts and those underneath that have to interpret like the new doctrines from the Supreme Court are a lot more mixed. So it's going to be a bumpy road in the years ahead, both in terms of the playing out of the cases from the last 4 years, the rules finalized really in the last year when they were finalized. And as the Trump administration tries to roll back things, that's why I say, like, when they talk about like day one executive orders of repealing stuff and having an unelected, unaccountable Department of Government Efficiency dictating sort of what rule, there's nothing in the Clean Air Act that says Elon Musk can say what a law is. I mean, there's a law that has to be followed. There's public comment. There's things that has to happen. So we'll see. It's going to be an interesting ride. Unfortunately, at the end of the day, even delay and uncertainty and this bouncing back and forth doesn't do anybody any good. It doesn't clean the air, and it doesn't, it doesn't make the regulated industry's lives any easier. But that's what this deregulatory sort of push gets you, is a lot of pendulum swinging and uncertainty. At some point it'd be easier just to implement it and do it, and everyone knows the rules of the road and can make the investments that they need to make. But thanks for saving that doozy for the end and squeezing it in. Well, that's a good question.
Yeah, sorry about that. But I mean, yeah, it's
It's
good to know
important.
going ahead what this new set of rules is going to look like, how we can best advocate these really strong policies like the citizen science and grassroots movements, how we
Yeah.
have just can just distribute that over, just spread it like wildfire per se across these different platforms.
Yeah.
Yeah, thank you so much.
Thank you.
Yes, thank you for saving that amazing question for to wrap us all up. But just to close us out, today we've seen how EPA air pollution standards save lives, improve health, and address environmental injustices. We've heard experts' insights from Jeremy and Dr. Costa and engaged in meaningful discussions about solutions and opportunities for action. This isn't just about policies, it's about creating a healthier, more equitable community where everyone can breathe easier. Let's turn our knowledge into action. Sign the Climate Action Chamber campaign petition, and it will be in the chat. Every signature strengthens the call for cleaner air and healthier futures. Share this petition with your networks and inspire others to join the fight for environmental justice and public health. A heartfelt thank you to our speakers, partners, especially Change the Chamber, for collaborating with us on this event. Your support has been invaluable. This is just the beginning. Together, we can continue to advocate, educate, and push for policies that protect our air, our health, and our communities. Thank you for joining us today, and let's keep the momentum going. Hope everyone has a great rest of your Thursday. Good luck on finals if you have finals, and I hope you have a great next semester, and happy holidays, everyone.
Thank you. Thank you. Thank you so much.
Thank you.
Wishing you the same.
Thank you.